Hello, my name is Jenny Kilpatrick, and I work for the Alabama Department of Public Health here in Baldwin County. I'd like to thank you for allowing me to come here today and speak with you regarding the Baldwin County response to COVID-19. We at Public Health are grateful for the support of our partners here in the Baldwin County community. Everyone is truly coming together in a remarkable way to combat this disease. These collaborative efforts remind us of how lucky we are to call Baldwin County home. And at this time, we'll open it up for some questions.
All right. Jenny, can you tell us about the Health Department testing clinic today?
Yes, we had our first County Health Department testing site here at our location in Robertsdale today on Gilbert Drive. The clinic was open from 10 to 2. We had patients that were seen there that had called first to be assessed, and then appointments were made. We do plan additional dates for additional testing sites based on test kit availability.
What is the best way to disinfect my house, my computer, and my cell phone?
In addition to routine cleaning, any surfaces that come in contact with hands frequently, such as doorknobs, light switches, countertops, toilet bowl handles, anything like that, should be cleaned and disinfected twice a day. When it comes to electronics, things like your cell phone, laptop, tablet, it's recommended that you follow the manufacturer's guidelines for cleaning and disinfecting. If those are not available readily, those can be cleaned with a spray cleaner or a wipe that contains at least 70% alcohol.
We also received a question about additional symptoms related to COVID-19. What are some of the additional symptoms that you should look for this virus?
The primary symptoms for COVID-19 at this time remain fever of 100 degrees 0.4, not 104, but 100.4, cough, and shortness of breath. Those remain the primary symptoms of COVID-19.
So what do I need to do if I think I have symptoms?
We would encourage you to stay at home and call your primary medical provider. That way you can discuss your symptoms and any risk factors that you may have. If you do not have a primary health care provider and are finding difficulty in getting screened and seen for this, you can call our 24-hour COVID-19 hotline available through Public Health.
So I hear that new testing sites are opening in my area. Can you talk about the protocol for testing? Should we just show up?
No, we would encourage you to call first any testing site that you would like to visit. You definitely want to call first and be screened. The criteria for COVID-19 testing through Public Health is going to include the following. You would be symptomatic with fever and cough or shortness of breath, and you would need to be 65 or older, a healthcare worker, a person with conditions that place you at higher risk. Examples of these would be diabetes, heart disease, asthma, cancer, and other conditions that would weaken your immune system.
When does the governor's stay-at-home policy end?
The current order is in effect until April 30th at 5 p.m.
Will I be able to return to work or life as normal when the stay-at-home order ends?
We would encourage people to stay informed and to follow this rapidly evolving situation. We are all eager to return to our lives as they were before, but we just need to exercise some patience in seeing this through.
Hey, I'm Zach, Director of Baldwin County. Thanks for joining us today. We are going to take several of your questions and concerns and answer those in this short segment.
What businesses are deemed essential?
Right now, we are getting asked what is an essential business. What we look at is guidance from Homeland Security, and what we're trying to deem essential are any major logistics functions, public works, utilities, obviously grocery stores, gas stations are included.
Yes, Director Hood, could you tell us some of the activities while we can leave the house?
One of the major questions that we are receiving are, what activities can I leave the house for? What can I do and still be following the guidelines set forth by our governor? What I encourage you to do is only leave your home when you have to. You may need fuel, you may need your common commodities such as food and water, or even to be able to pay a bill. Those are essential activities that you may leave your home for.
Director Hood, is it safe to go to the grocery store?
Absolutely, it is safe to go to the grocery store. Our grocery stores are doing a great job in implementing measures for social distancing to be followed while shopping. You may have to wait outside. You may also be asked to stand back before checkout. Those are just a few measures that are put into place right now, and it varies store to store. Our stores are doing a great job at keeping supplies on the shelf, but also they're doing even better in ensuring that we limit the possibility to contaminate each other.
If we're not leaving home for one of those essential businesses or activities, we just supposed to stay at home?
So the question is, if it's not an essential activity, do we just have to be confined specifically to our home? One of the things I would like to point out is exercise is included in as an essential activity. So not only is it a good way for stress relieving during this time, mentally it's challenging being stuck in our homes trying to obey the guidelines and the orders in order to help our community. So exercise is included as an essential activity, of course maintaining your distances from individuals you may encounter doing the same.
So can I go to the park or to the beach or to the bay and exercise as you're talking about?
Right now, our parks, the bay, the beach remain closed. This could change if we continue to do a great job at not spreading the infection in our community.
We've seen the term stay at home and shelter in place. Can you explain those terms to us?
So the question is stay at home versus shelter in place order. Stay at home order is what we are under now in dealing with COVID-19, and there are parameters where we actually can leave our home to take care of essential functions that we need to do in order to live our daily life. Shelter-in-place orders are for your immediate safety. In the event that there is an immediate threat, a shelter-in-place order would be issued and you would be asked to stay confined within your home.
Director Hood, can you give an example of when a shelter-in-place circumstance may exist?
Hazmat-related events, maybe acts of violence, and others. However, at this time, we are not in a shelter-in-place or under a shelter-in-place order. Again, we are encouraged to stay at home, only leaving our home when we need to.